Check is proudly brought to you by First Capital Bank. Belief comes first.
All right. Good morning, Dr. B.
Morning, Dr. Z.
Love that. Thank you. How are you doing this Sunday morning?
I'm good. You?
That is perfect. I am absolutely amazing, Dr. B. I had a great show yesterday. I'm smiling. You know, it's a great Sunday.
I hope we're not going to lose you at some point, with all this popularity.
Well, let's not talk too much. Let's not talk about that, Dr. B. Yeah, we're talking about breast cancer awareness today.
Yeah, it's Women's Month, and the issue mainly is breast cancer. It is something that is widely talked about.
Yes.
I can see, there are lots of trucks and mobile things moving around, getting people tested, and it is an important subject, a subject close to many women's hearts, for want of a better word, and it is something that what is breast cancer? It's a cancer that forms in the breast. It is one of the leading causes of cancer-related deaths among women. So it's something that does need to be taken seriously. And it is something that is highly screenable, both at home as well as with modern technology. And it is something that we do encourage women all over the country to start checking. So regular checkups and screening tests can find breast cancer at an early stage. That's when the treatment works best. And the most important action, I think, that's important is to have regular breast cancer screening. Now, people always ask who gets this cancer. Well, all women can get breast cancer, but the causes of breast cancer are still really unknown. But the chances increase, obviously, when you're getting older, because most women who are diagnosed, to my reading, are generally over the age of 45, 50. But here are some interesting, important things for women out there to listen to. If you've had your first menstrual period at a very young age, so younger than the age of 12, you're at much greater risk, because what happens is many of the breast cancers feed on hormones. So the more your hormones fluctuate, as in the menstrual cycle, the more likely it is it can actually sort of disrupt the tissue in your breast and can cause that. In addition, starting menopause at an older age, in other words, the longer you have your period, so over the age of 55 to 60, you're still having your period, you're at much greater risk because you're still fluctuating in terms of your hormonal profile. And interestingly, never giving birth, if you never had babies or children, you're at much greater risk, particularly...
Hi, Dr. B.
It's true. And this was studied and picked up in nuns, people who joined the church, and incidence of breast cancer in nuns is much greater for two reasons. One is they don't have children, and the second is that they don't breastfeed.
Yeah.
So because breastfeeding actually stimulates, release and opens up the circulation and the drainage in the system, and so we know that nuns are much greater risk of getting breast cancer, and this is what it's come down to. So it's really important to try and, I'm not encouraging this, but generally women giving birth before the age of 30 are much less likely to get breast cancer.
So I need to hurry up, basically.
Well, I didn't say you.
No, I don't mind about my age, Dr. B. Age is just a number. I just turned 30, so I'm really, really trying to wow.
The biological clock and all that, yeah.
Taking.
Well, so that also, so again, also there's a family history. People who have a close family member,
yes,
parent or sibling or child who's had breast cancer, especially at an early age, gets this done. And there are certain gene mutations. And of course, the famous actress was Angelina Jolie, who had what's called the BRCA gene, BRCA, and then you can actually test for that in our country. And if you have this BRCA gene mutation, which is BRCA1 or BRCA2, you are at very high risk of getting breast cancer. And some women these days actually opt to have, their breast removed, mastectomy, because of the high risk that runs in the family. So this is important. And then from my perspective, being overweight, drinking alcohol, not getting enough exercise, smoking, and long-term use of hormone replacement therapy, things women use after menopause to reduce their flushing. These are all things that need to be given
close attention, yeah.
Yeah, and of course, somebody's already asked you, what are the symptoms of breast cancer? I'm a 28-year-old, and sometimes I get pain during my periods. That's not generally a breast cancer. That's usually just hormonal-related changes within your breast. There's changes in fluid retention, and the breast can be tender. But the most common sign of breast cancer is a new lump or mass. And this can always be picked up in women who are taught by nurses and doctors and the clinics out there how to do self-examination. I think that's really the most important thing, to examine your breasts on a regular basis, and it's very easy to be taught. So do that. And a mass that is painless, hard, has irregular edges is more likely to be cancerous. If there's swelling on any part of the breast, if there's irritation or sort of a dimpling of the breast, like it'll sort of almost looks like an orange peel, this is something important. If you have nipple pain, if there's retraction where the nipple turns inwards, if there's redness or scaling or thickening, and even discharge other than breast milk, all these things are things to be taken seriously. And honestly, in some of our clinics, we pick up these so late, or women are so reluctant to come. They actually come with these huge masses, and you just wonder, why have you been sitting on this for such a long time? So it's really, really important to do that. And somebody asked you, how can I lower my chances of getting breast cancer? My mum had breast cancer, and I understand one of my aunts that, well, if that's the case, you need to go for screening, because that's really important. We don't generally advocate screening below the age of 40, but if there's a family history, go and see your doctor, because what you're telling me is actually it may run in the family. But of course, in terms of the preventive issues, like I say, get regular exercise, staying a healthy weight, drinking less alcohol, breastfeeding. If you've had a baby, breastfeeding is best for baby as well as for you and your breast, and also stopping smoking if you haven't stopped already. So these are really important issues that are relevant. Somebody's asked here, how do I keep my breast healthy? Well, we've talked about this. Maintain a healthy weight, exercise, minimize alcohol, veggies, target your motherhood when you want to have a baby, and quit smoking. This is important. Somebody's asked, I think it's the same person, which fruit is good for the breast? I don't know.
Is it our banana friend? Yeah. Hi, Dr. V, please now.
I think this guy or girl is crazy. What vitamin is good for breast health? The most recent study indicates vitamin D. Vitamin D can actually help reduce your risk of breast cancer. So that's important. Where do you get vitamin D? You get it from fish and eggs and the sun. Somebody's asked you, how do I know my breasts are healthy? Well, a change in the color or outline or shape of your breast, a change in the look or feel, such as we've talked about, that sort of puckering, dimpling, or rash, or red, or lump, that generally says you need to stop and take listen to that stuff. So that's important. Somebody's asked you, is breast cancer curable? Yes, if you pick it up very early and it's just limited to the breast itself, definitely. Most women who are picked up at that stage live for 5 years and more. So it's really important to get that done. Somebody's asked you, where does breast cancer spread first? Well, it often spreads to the bone, to the liver, to the lungs and the brain, and often women in the early stages, when we didn't have good enough treatment, would go into remission for years, and then suddenly we've discovered something in the lung or the bones or the brain. So after your chemotherapy, it's always important to keep checking up in terms of your breast cancer.
Well, Dr. B, I also wanted to know, because kolapeng at home, sorry, we have a lot of cancer that has taken my grandfather, his sisters as well. Will I then be at a higher risk of getting some form of cancer?
No, the answer is no.
Okay.
Unless there are only some cancers that are inheritable.
Okay.
Generally, you find cancer occurring in families largely because of their eating habits or their lack of exercise or bad habits, rather than a genetic issue. Unless it's breast cancer. Most other cancers are not inherited, and they're generally due to lifestyle issues that we've talked about. And the cancer is on the rise because we're consuming some of these toxic foods, because we are inhaling some of these toxins, these are artificial fungicides, pesticides, insecticides, plastics that we're actually drinking from. All the stuff we now know is actually causing some of the problems in terms of alcohol, in terms of cancer.
Yes.
So that's generally it. But if there's a family history of breast cancer, bowel cancer, and in certain cases prostate cancer, it can be inherited, and you can check for these things. So I always advocate, prevention is better than cure. So if you're in doubt, go and see your doctor and get it checked out. It really is important, because particularly this type of cancer, it wreaks horror and havoc in women's minds, and it is something that you really can take control of by just doing a regular breast exam.
All right, Dr. B. Well, that's the time that we have for today. What are we going to be talking about next week?
Next week, we're going to be talking about something that some of our younger listeners have been asking about, and that's wearable technology. Everybody's got a watch or some sort of device they're wearing on, and it measures all sorts of things. And how useful is it? Is it accurate? What do we do with it? What are the disadvantages? So we're going to talk about wearable technology next week.
Great. I'm looking forward to that.
Cool, dude.
Have a great Sunday, Dr. V. You and your banana friend. Bye, Dr. V. And that's Dr. Bhagat and I on the Health Check. Join us next week as we talk about wearable technology.
Health Check was proudly brought to you by First Capital Bank. Belief comes first.